frustration. It started out of frustration during my hospital attachment, whereby I faced something some of us may also have faced, whereby you walk into the workshop, sit down, and you feel invisible. You might end up even spending the whole day being there in the workshop and doing nothing. You feel unprepared at the end of the day. You feel like you don't belong in the hospital system. We are taught theories for years. Yes, it is the basic and the foundational knowledge for what we are built for. But the first time you walk into a hospital or your place of work, you touch the real equipment, uh, maybe someone's life could be at stake, but you'll feel very unprepared. This is when I realized that the problem is not just for the students, but there is a gap. So we carried out a survey, and we had you guys participating in our survey, and this is what led to Africa being born. So Africa Lab, first and foremost, it is not a school, it is not a company, it is a movement to bring dignity, confidence, and innovation back to biomedical engineering. Our vision is bold and simple: to build African next generation of biomedical engineers who are not just good as employees, but ethical innovators, problem solvers, and future job creators. We want a continent where students train on real equipment before hospital entry and can be able to deliver on what they have been taught. Engineers who collaborate and not to compete. African build medtech solutions that are a norm to us and not the exception. We want a place whereby biomedical engineers play a central role in innovation, policy, and system design. In short, we want to become the Moringa School of MedTech, built for Africans by Africans. You being here shows the belief for this moment. You are the pioneers. These series are not for passive listeners. It is for builders, and that is who we are today. The dreamers and the young engineers who want to take back their power. Today, feel free to ask questions in our poll there, in our Q&A there. Share your thoughts in the chat, introduce yourself, and if someone speaks to you and that thing resonates to you, say it. Because this is the beginning of a conversation that will grow into boot camps, simulation labs, and innovation spaces. With that, allow me to officially open our first mentorship session. I will invite, once again, hand over to her, my co-founder, Caroline, to take it from here and introduce our speakers. Thank you for being part of history. Welcome to Africa Lab, where we equip, innovate, and transform. Thank you. Over to you, Caroline.
Thank you so much, Karani. That has been very insightful on what Africa Lab is and what you do. So I'm hoping people will engage us more on the chats and tell us more about what they want to hear, what they are expecting from us. And I hope they'll be here keen to hear about our speaker. So let me introduce our first speaker. Our first speaker is Patricia Manana. She's from Uganda. We will take you through this journey today. She's from Uganda. She's an assistant biomedical engineer at Makerere University at the Walter Reed program. She is also a biomedical engineer in Sultan Health Limited. She holds a bachelor degrees in bioengineering and biomedical engineering from Bara University, Science of Technology. She helps develop tools to support national research programs. She mentors young scientists and also advocates for the health systems and women in STEM. So let's give her a hand, a clap for Patricia. Let's hear what she has to say. She can tell us, let us be keen listeners and be ready to learn from her and her experience, although she's across the border. Welcome, Patricia.
Good morning, everyone. Can you hear me?
Yes, we can hear you. Good morning,
Oh,
Patricia.
morning. How are you?
We're good, we're good. Can take over.
So I'm having some technical issues because I haven't used Zoho meeting before. I wonder if anyone could help me. You guys can see me
Yes, we can.
and you can hear me.
Yes, perfectly.
Now the issue is I can hear myself as well.
I can see you have two accounts registered.
Yes, please. Anyway, let's just go on. Thank you so much, Caroline and Karani. I'm so grateful to be here. I'm so glad that you gave me this opportunity to come and mentor young engineers because without mentorship, I wouldn't have been here as well. So, as Caroline said, I am a biomedical engineer, I am an innovator, and I'm also a researcher. So today I'm going to just really be taking you through my experiences. You can pick out what resonates with you. You can feel free to ask me any questions I think at the end of my talk. And yeah, that's basically it. So before we start, I just want to ask you one question. How many of you knew about the biomedical engineering profession 10 years back? Because personally, I did not know about it. Growing up, I always thought that I would be a medical doctor. Actually, it was my family members. It was more influence from, from my family, and I always thought the let me just reduce this volume because it's making noise. So, as was saying, I only knew about engineering as I was getting into uni. So I was telling you how growing up I wanted to be a medical doctor. Also, I thought so at HSC here in Uganda, we have from Form 1 to Form 6. So Form 5 and Form 6 is where you decide, like you choose a career path. So in Form 5 and Form 6, I did biology, chemistry, and math. And then when we went in for the biology practicals, I didn't like the whole idea of dissecting rats, pods, and cockroaches, and I can't stand the sight of blood. Ew. So at that point, I was like, you know what? I'm not going to become a doctor. So at the end of Form 6 is when I decided to do some research because one thing was for sure, I wanted to still be in the medical field. And at that point, that's when I found this course, biomedical engineering, that's at the intersection of medicine and tech. And the question is, what is biomedical engineering? You see, I keep getting asked the same question. But Patricia, what exactly do you do? What do you do? You know, what do biomedical engineers do? And there's another category of people that think biomedical engineers are just guys that require that repair equipment. You get it's just guys that repair equipment in hospitals, and you know most of okay, that's part of it, but that's not entirely the whole thing. It's like only a cup full out of an ocean. And I usually here in Uganda, as when people finish school, they either go into hospital equipment maintenance, repair, and all those things, or they go into sales. And I have a lot of colleagues who are stuck in doing sales, but they don't like it. But then again, like the field of biomedical engineering is infinite. You can be an innovator, you can go into QC, you can go into academia, you can do so much. Like the field alone is vast. You can go into digital health, and it's not a must that you should be employed. You can go ahead and start your own innovation. You can be a founder of things, but guys usually don't know this. And I think the issue stems from campus. When we were at campus and we had to go in for industrial training, our lecturers gave us lists of potential places that we could go to and ask for internship and all. So the list was only filled with hospitals. And for me personally, all the places I did internship were hospitals. My first internship was a hospital. My second internship was a hospital. My third internship was even my volunteering after school was a hospital. But that doesn't have to be it. Of course, if you're passionate about equipment maintenance, being in hospitals and all that, there's other ways to contribute to the medical field than just sit in a workshop, in my opinion. But it all depends on what you are passionate about. And then I think the second issue here in Uganda, I think biomedical engineers are not given the same grace or treated like other medical personnel, like doctors, guys who do medicine, pharmacy, nurses. Once they finish their courses, they go for a compulsory internship, 1 year internship, which is not the same case for us. So basically, they get the exposure, they get the 1 year experience, like it opens them out to the world. So I feel like that way biomedical engineers are kinda left behind. And then my third issue, I faced, this one is a bit personal, was gender biases. In 2023, when I was looking for a job, at that point I was interning, but I was also looking for a job. I went for this interview with a company that I want to represent, and then my interview was very nice. I answered all questions. I feel like the interview went well, and they told me they'd get back to me in a particular time frame. This time frame elapsed, so I reached out to the hiring manager. Like, yeah, you said you would reach out to me, but you've not reached out to me yet. And the man blatantly told me, yes, you passed the interview and all that, but for us, we know engineers are supposed to be men, and that's how I was overlooked for that opportunity. But yeah, but I'm going to just take you through how I've been navigating things, how I moved from campus to the work field, and what maybe you could pick out some tips that could help you on this journey. So while I was at uni, the biggest favor I did myself was going to leadership, student leadership. This one just doesn't teach you things, but it also gets you connected. So my university had a Rotaract club, which I joined. And then in the Rotaract club, I took on various positions. I did project management. I was a secretary. Like I did a lot of things while I was in this Rotaract club, and like it connects you with people, and connections open doors that your expertise that might not open, because for my internships they were a bit easy to get since I knew some people, or I knew people that knew people. So I'd tell them, could you talk to so and so? I need internship. Now for us, our internship is not that internship of 1 year. It's typically 2 months, and You just go there for the 2 months for you to just get exposed here and there, and yeah, move on, write a report, and that was it. So on top of being in Rotaract, and the other thing I liked about Rotaract was they used to give you mentors. As you're new, they give you a mentor, someone who has been in the club for long. So really, extracurricular activities played a huge role in my growth. And then I was also assistant education officer for my SDG hub, sustainable development goals. And then basically I used to take on responsibility. It just opens paths for you. And then the second thing I did while I was at campus that I see really helped me now was attend hackathons. As an engineer, you must, okay, you should attend hackathons, because in hackathons, okay, for guys who don't know what hackathons are basically they are workshops where like-minded people, engineers, doctors, pharmacists come together, and then they give you groups. Of course, these groups are random, and then they tell you to solve a particular issue. So this one gives you hands-on experience on things that you would never learn in class. For me personally, all the coding I learned, basically my innovation journey started with hackathons. I have designed apps. Uh, I've designed apps. I've designed devices, smart devices. I have designed a lot of things, and you end up finding that these things can also help you to put on your CV, and you're not like someone who has not attended a hackathon before. And these things are taught in class, because in class we are taught to use Arduino boards, we are taught robotics, but in hackathons you innovate with a purpose. You're like, I'm solving this and this. Okay, one of the things I solved was asthma attack. Basically, we designed a smart device, a suppressor that could help you detect asthma attacks before they occur, so that you do something before and the asthma attack is not that much. So, of course, before we knew how to use Arduino boards, we could write code, but in a hackathon, somehow you learn to bring that to life. Sadly, none of the things I've innovated have hit the market. I guess that's like a systemic issue. Or I don't know, I shouldn't blame that also. And then the other thing is attend fellowships. There's always sites where you can find opportunities and then apply for them. Of course, there's massive rejections, left, right, center, rejections. But like, if I let rejections define me, I wouldn't be where I am right now, because rejections are inevitable. But always attend fellowships. These fellowships will expose you to people who are maybe not in your demographic, who are not in your country, who have different perspectives, who are maybe smarter than you, who you can share information with. And personally, my favorite fellowship I attended was the Millennium Fellowship. It opened doors for me really. I made friends and worked on projects, did innovations. It is really important to attend fellowships. Then the other thing could be get affiliated with your university's engineering association. Now, for us in Barara, it was called Barara University Engineers Engineering Students Association. Those guys can open doors for you. You continue to learn. Yeah, it's basically peer to peer. It's someone who you are not scared of, because usually if you're going to an older person for advice, you could be a bit shy. But when it's your friend that you are usually chilling with in hostel, it's easier to share knowledge that way. And then that's basically what I did in school. Most of my journey in research and innovation started when I was still at uni. And then here comes life after campus. You guys, life, life after campus. Of course, it is hard to navigate life coming from uni to real life because what's on ground is a bit different. It's not a bit different, it's different. So basically, now for me, it was, I think, hard for me because I was studying in Barara. But my home is Kampala, is in Kampala. And that's 200 kilometers apart. All the connections I had built, I had made, everyone I knew professionally was in Barara. But here I am, the course is done. I have to move back to Kampala, huge city. I do not know people. I do not have connections. The best thing I could do at that point was to volunteer. So I volunteered at a hospital. It's a referral hospital. It's called Kawempe Hospital here in Kampala. And of course, that gives you exposure. You keep learning. Now it's not like school itself. Here you're learning, you're doing the hands-on, you're holding the screwdriver, you're screwing things, you're troubleshooting things. I honestly learned so much from my volunteership actually. Then at that point, I was applying for jobs and all that. But the most important thing I did, okay, I'm going to just give you 4 tips that I followed. Number one is I built a career roadmap. A career roadmap just shows you a path that you should follow, and it is very flexible. It's not like, hey, because I drew a career roadmap in 2023 I should stick to that specifically. You have to go with something that's your passion, something that serves you. If you want to go into maintenance, if you want to go into sales, if you want to go into academia, if you want to go into research, you do that. So basically what I did for my career roadmap is you just need a pen and a paper, draw the first point of where you are right now. Then the second point is where you want to be with time or in the future. Then connect those two dots. And then on that line, you just keep putting like smaller achievable goals, more like milestones that will help you, the things that you follow on your way to achieving the things that you want. And honestly, that helped a lot. But the biggest favor I did myself was to get a mentor. I started with one, and now you just can't have one mentor, of course. And this mentor doesn't have to be where you want to be. They don't have to be a biomedical engineer as well. They can be anything else that inspire you. So I got myself mentors, and recently another lady reached out to me and she's mentoring me, and like I really like that. And then third was keep yourself informed. You must keep yourself informed. You see, we are in a fast growing world. There is emerging technologies, there is AI, there is blockchain. And personally, sometimes I suffer to keep up. Of course, you have a busy schedule. You're not going to take off time and actively go and look for, hey, what are the new things in AI? What's happening now? Tell me what. And in that way, like, that's not feasible, really. What I do is on Instagram, even TikTok, even Facebook, just make sure you follow pages that are going to build you professionally. You can follow IEEE, you can follow WHO. This helps you just know all the newest things. You can follow OpenAI. You can learn a lot of things, because once you do not keep up, you'll be left behind. Recently, someone was telling me how, hey, you see, AI is going to take our jobs, what. But I told him, AI is not here for your job, sir. rather someone who knows how to use it will take your job. So that's why I say you have to always keep yourself informed, seek knowledge as much as you can, subscribe to journals, subscribe to newsletters, and then that way you keep in the loop. At least you passively get to learn things, get to learn the information. And then my number 4, a thing I usually do is collaborate with peers. Sometimes we get familiar with our peers. You're like, what can this one teach me? But there's so much that they can teach you. Your peers are your very first connection. They might know something that you don't. They can collaborate on projects with you. They can introduce you to people that you never knew. Personally, I'm so grateful for the people in my circle because they teach me things. They connect me. They always say, hey, there is this and this going on. I think you'd be interested. You can always collaborate with your peers. If an engineer and I want to do research or write some research on, let's say, gender-based violence, I can collaborate with my friend who did gender-based studies. If I want to go into like schistosomiasis studies, I could collaborate with one of my friends that I work with at the lab. So peer collaboration is also key, and I guess that's what has brought me this far. Designing a career roadmap, getting a mentor, seeking knowledge. Make sure you're always looking out for knowledge. Guys, don't stop learning. And then collaborating with people really helps. Yeah, that's basically how I've been able to navigate this field, and yeah, I'm still on my path, and I'm grateful for how far I am. I hope you guys picked out something from my talk. Yeah, thank you.
Thank you so much, Patricia. We'll give the floor to anyone who has a question. You can write it on the chat. If you're shy, you can speak if you are able. Patricia is here to answer our question. Anyone who has a question, but her knowledge has been vast. She has told us how she has navigated about the medical engineering field from seeking mentors for her own experience and what has worked for her. Maybe it will work for you. Maybe yours will be any different, but I'm grateful for you sharing your journey. Anyone now, the floor is open to anyone who has a question.
Walter, you can ask your question.
Please, can you confirm if I'm audible?
There you are.
Okay, yes. Patricia, thank you for your talk. It's been very inspiring and I've learned a lot. I just had one question about, you seem to be a very busy woman, a very busy engineer. So I'd like to know, how do you manage to keep in touch with all the different activities you had to do? You told us you're on projects, you have work, you're looking for fellowships. How do you manage to streamline this process and manage to achieve everything that you're trying to do with amidst this busy schedule? Thank you.
Shall I answer that first or get all the questions at once and then move on? Anyway,
It's
let
okay,
me
you
answer
can,
that one.
yeah.
So, basically, how I manage to keep up with everything is you need to harness the tools that you have. I know most of us have mobile phones. All mobile phones come with calendars. So basically what I do, I always block out time. In the morning, say, will be for me writing my papers, writing my research and all that. And then say in the afternoon, I'll have meetings with this person, meetings with this person, meetings with this person. If that's what you're asking, that's how I manage to handle multiple things at a time. And it is important to always set reminders because I'm quite forgetful, but this system just helps to remind me, because most of the times you get overwhelmed. You get overwhelmed by, you're on this project, you're in another project, you're on this paper, you're also on the other paper, and on top of that, you have work, your normal day-to-day work. So what helps me is I always, when anything comes up, I always write it down. Say if I have a talk or I go to a conference and meet a person a prospective person that I could partner with and all that, I always make sure once we agree that, oh, we should meet up sometime, I put it on my to-do list, on my tasks in Google Calendars. You can put it on your tasks, and then you can write events on your Google Calendar still. I don't know if guys who use iOS have, I know you also have calendars, but that's what helps you never forget anything, never miss out on deadlines, always have reminders. Yeah, that's basically how I try to make sure that everything is in order. And I won't say that I never forget things that I'm meant to do. I never miss out on meetings. When you do, you're human, and that's very okay for you to do. What you have to do is take accountability. Speak to the people in that project. You're like, you know what, I missed this, and how can I make up for it? And that's all, because when you keep missing projects, I mean missing meetings like that, people will chase you off their projects. Yeah, so that's basically what I do. I just use my Google Maps, I mean my Google Calendar.
Thank you, Patricia. Anyone else who has a question? You can unmute and speak.
Someone is asking, as a biomedical engineer, which areas should students in Africa focus on for innovation or projects? Which areas would one prioritize in?
Okay, for that one, Africa is riddled with disease. There's Ebola, there's Marburg, there's malaria, there's cholera, there's, on top of disease, we also have things like hunger. People are struggling with hunger, people are struggling with a lot of things. Basically, Africa has a lot of struggles, and that, I wouldn't say is a good thing, but for you as an engineer, it gives you like vast opportunity. Like you can do anything. From most of the thing I should tell you to focus on is the innovation. Innovate for Africa. How do we move forward? How do we stop um, looking for jobs depending on the systems? We need to redefine our systems. So as an engineer, you have to make sure that you innovate. Just pick a problem, anything that you're passionate about, and work towards solving that. It could be, your innovation could be through diagnostics, RDTs. The funny thing is, most machines that work with, none of them is manufactured in Africa. You could innovate your machines low cost for hospitals, for research institutions. All you have to do is like set your mind to it and innovate. And the good thing is, right now there's the internet. We are equipped with the internet, and we could just Google. We are one Google prompt away from innovation. You could, if it's hunger that you're trying to solve, because biomedical engineering is a huge, vast field. You could innovate for Africa in any way. So the thing, if you want to innovate for Africa, is to just make sure that you go into innovations, because the Africa has a lot of gaps that needs us, the younger generation, to solve. We can't continue relying on the US to send us aid. We cannot keep relying on countries out there, on the UN to send us aid, because up to when are we going to wait for people to come and save us? Yet we have the resources, we have the knowledge, we have the capacity. We are Africa has the most youth on the continent, and there is so much potential in Africa. There's a lot of gaps that could be solved by innovation, really. Yeah. Someone in the chat says, could you speak a bit more on the area of mentorship, i.e. how to pick one, and also how to guide on that journey? Now, for this one, I'm going to just give you my personal experience. When you're looking for a mentor, you have to keep in, they don't have to be an engineer, because my very first mentor wasn't an engineer. You have to ask yourself, this person that you have in mind, how are they doing in their field? Have they, surpassed the odds? Do they have what I'm looking for? Do they have, are they a good person? Because some people are not going to mentor you just because. And like, are they well-wishing? It is important to have a mentor who is well-wishing. Personally, my mentor and I, my very first mentor and I, up to now, we still meet up for lunches. So I give him progress on how far I have gone, what I have done, and basically his role is to encourage you to move forward. He could use his connections that he has, because usually the mentor is older than you, so they have connections, they know people they studied with, they basically could open doors for you. So when you're choosing a mentor, you have to just ask yourself, what this person is doing. Would I want to do it too? Would I want to be in a position this person is in right now? And if the answer is yes, then you can choose them as a mentor. And for me, how I chose, how I came to be mentored by him is, I was straightforward. I I had gotten his number, so I texted him on WhatsApp. I'm like, hi, I like the work you do. I like what you've done with this and this. And even if you're not in the same field as I am, I really want to learn so much from you, because you look like you have things that you could offer. And I was very surprised, because I thought he would tell me, nah, I'm busy. He was very nice about it and was like, yeah, of course I can mentor you. When do we start? And basically, when he comes across opportunities that he thinks I could apply for, he sends them my way. And then when there's any opening, he always tries to, like, make sure I get as exposed as much as possible. Of course, your mentor is not going to do things like pay tuition for you, what they are meant to do is guide you. And
Are you
that's
still?
how you get that's how you go in for mentors.
Thank you, Patricia. We lost you a bit, but
Yeah. Sorry.
uh,
I was
but
concluding.
it's okay. Yeah, it's okay. Thank you for your time. People can look for you in your LinkedIn if they have further questions, so that we are able to move to our next speaker. We don't have to keep people here, so that they get the anticipation. Patricia has brought us through her classroom journey to what she thinks the engineers in Kenya need on what. And one thing she mentioned was innovation. Our next speaker will be speaking more of innovation. Her name is Winnie Kiburi. She's a mechanical engineer by profession. She's the vice chair of Transforming Africa MedTech Conference this year, 2025. She's a medtech lead at Virgo Africa. She does medical engineering designs reviews. She leads in initiatives that support stage startups of medtech and from product development to engineering clinics to clinical trust frameworks to regulatory approvals to market strategies. And so she'll talk about more about innovation, and let's hear her.
Thank you, Wanjiko. I like to correct a bit. I'm not Kiburi, but Kibiru. So
Sorry
I think
about that. Sorry about that.
yes,
Sorry about that.
Kibiru. Yes.
Yeah,
No.
thank you. Thank you.
Good morning, everyone. Happy to be here. And it's surprising I'm also doing this Zoho meeting for the first time. I don't know whether this is the new thing for the new innovators these days. A lot of us are used to Google Meet, Microsoft Teams, or even Zoom. So this was a bit new for me. But thank you for having me here, Karani and Africa Lab team, for inviting me. It is a pleasure to join this conversation of reimagining biomedical engineering in Africa. So my name is Winnie Wangari. I'm the medtech lead at Vilgro Africa, an incubator and accelerator supporting some of the innovative healthcare technology within the continent. As we all know, and what was already mentioned by Karani in his first meeting or in his first conversation, about a lot of Africa face complex in terms of the biomedical engineering being fixed at one position. But today, Africa is facing other complex healthcare challenges that biomedical engineer could help and surface some of those challenges in a unique way to which can be viewed in a different way. Looking at solutions from neonatal care to diagnostic to chronic diseases and access to affordable medical devices. Yet we've also have some extreme powerful generation of upcoming biomedical engineers, such as you. But with the movement and continuation of the efforts, we must be as well move beyond the old ideas of biomedical engineers as people who fix hospital machines. You are the future creators, designers, innovators, and problem solvers who will definitely be here to help Africa build the next generation of Africa solutions. So just to keep you on this innovation space, you being the engineers and you coming in as innovators, the innovation starts from seeing the problem clearly and asking, what can I build that doesn't exist yet? Just iterating from my previous speaker, you need to develop solutions that you're passionate about, problems that you've experienced in one way or another. Don't innovate solutions that are just there just because you want to build solutions. This has to come from a good understanding and a clear problem understanding and asking yourself, how are you gonna be part of this existing solution? And building on the skills that you are learning, which is design, embedding electronics, mechanics, physiology, are exact skills needed to create life-saving devices, diagnostic, digital solutions that will fit within the African realities. So who we are as Vilgro Africa? Vilgro Africa, or at Vilgro Africa, we have worked with more than 100 healthcare innovation startups across East, West, South, North Africa. And our strongest thing is very much common, whereby we have an engineer who believes they can build something real, test it, and improve it. But that does not entirely enclose it to engineer. We've had innovation from actually patients who have experienced some deficiencies in a particular solution. We've had doctors, we've had health hospitals coming up with solutions that could actually make their work easier. So some start with nothing more than so some people just start with nothing more than an idea and a simple prototype, but with the right mentorship, regulatory support in this field that we are, which is very crucial, which is understanding the regulatory support. Iterating from the previous speaker that you need to be moving with the trend, understand the technical transfers that you need to onboard into your solutions, but more precisely, you can't just develop solutions and adopting technologies, but you're not having a key understanding of the regulatory support that comes with this space, which is very rigid and not forgiving. Yeah. And one thing is also keeping in mind, if you're passionate and if you're very sincere about the solution that you're coming up and sincere about the problem, more precisely, the user feedback and assistance is required as well. So with that said, I like to also share that one of the biggest shifts that also comes into mind and in your journey of changing the way you see yourself in the space of changing how the biomedical engineering is, and also in terms of shifting yourself from being just one side of a biomedical engineering, of which we all have an idea of what that looks like, being fixed in the hospital, but moving into an innovator. You must be in a position to change the way you are by looking at not just being a technician, not just as a person who's standing at a periphery of healthcare, but as a co-driver of innovation. Every medical devices you see today started with an engineer who said, I see a problem, I believe there is a better way. Innovation begins with curiosity. It grows through problem understanding, and also it becomes real through prototyping, testing, failing as much as possible, improving and trying again as much as possible. And if you can carry this particular mindset, then you will be in a position to change how you think about innovation and how you think about healthcare on this continent. Because everything, even government fail, and they try again, they fail till they perfect it. And that's how you should see yourself as innovator. So our day-to-day activities at Visgro Africa, as you see, we support startups across the different part of the continent. And the truth is, the most successful teams always include an engineer who is bold enough to build something real. Some start with nothing but scrap materials and an idea. Others come with academic knowledge, but no practical exposure. But with mentorship and training and regulatory guidance and perseverance, marry and end up launching a real-world device. So iterating to the previous speaker about mentorship, you should be smart about it. Biomedical engineering is very broad and is very wide. So you will be required to understand what kind of professional direction you really need to look at. Even if it's innovation, it's very broad. You need to understand and be in a position to onboard the kind of mentorship that ones require. I said it doesn't have to be in the engineering, it can be in any field, because innovation is actually complemented by those different fields. Yeah. So you are the kind of talent that actually will help a lot of innovation-based enterprises that are creating hardware solutions. And hardware solutions are not just basic solutions, but iterate a lot of learnings and growth as well as. Let me give you a few Practical insights I've gathered from working with innovators. The first one is staying close to the users. We always insist on seeking the right problem and seeking the right solution for the right users. And one of the query things I always always ask the innovators, how is the user coming here? How, because everything that you are innovating is to actually address a particular problem, and those particular problems are being faced by a particular end user. So the answers you are looking for are in the wards, in the labs, in the maternity units, in the rural clinics. Talk to nurses, talk to doctors, patients, and they will show you the real unmet needs. And that's why I said, don't build from something that has already exists, but something that is unique and will address the problem in a very secure way. And if you're able to address the problem in a secure way, your business or your innovation is also able to grow. And you know, when your solution is recognized and meets the user, the more checks comes in. If the more checks comes in, the more you smile, the more you're able to impact the BOP, and you're able to grow as well, because it doesn't stop at just innovating, it goes beyond than that. So the innovation is like the 0.1%, and then there's the rest, which is the 99.1% that you need to work on. Yeah. So ideas means nothing until you build something. So even a simple rough prototype teaches you more than month of theory. A device cannot reach patient without regulatory clearance, so you need to understand how to learn and embed yourself in the standards, such as the ISO 13485, safety requirements, clinical validation, so on and so forth. There are so many variants that comes into mind when you're looking at the regulatory at the early stage of understanding how that comes into innovation. Ask yourself, in terms of thinking about the scalability of from the start, ask yourself things like, how will this be manufactured from the beginning? What will it cost? Who will pay for it? Who will reach? How will it reach to those right people? And that's why I say the mentorship is not just about the fellow engineer. It could be business person. It could be patient. It could be those patients. I mean, it could be those those people who you tend to buy to sell the product to. So it varies from different aspects. So innovation isn't just technology. It's embedded with technology, business, regulatory, and user adoption. And I like to believe that Africa is entering a new era of healthcare innovation. I was just from a conference in Mombasa, SCOMRA, that was speaking about the sciences in medical products, yeah, in Africa, and how to harmonize regulations, and how the NRAs and the manufacturers and the regulatories could come together and work on a seamless way and align on regulatory product acceptance within the context of Africa, given that within Africa and different countries and different regions behave differently with innovation, behave differently in manufacturing, and so on and so forth. So it was very much seeing that there's an improvement in terms of the mindset from the regulatory side, and AMA coming through will be a good way, but for the pharmaceutical and drugs. But for the medical devices, we still have a journey as well, but it's something that they're looking for. So in clarity, in terms of how the new era in the health innovation is coming through, is also being powered as well in that side, not leaving alone the capacity buildings that comes with these changes and these new eras that needs to be enlightened further and further. And there's something that they were showing more about. So biomedical engineer is not just technical career, it is a calling to save life, improve systems, build on the future of healthcare on our continent. And at Will Grow Africa, we really are committed to supporting innovators who will come out to have an emerging solutions and grow with those solutions. And hopefully through these fast and follow-on conversations with Africa Labs, you'll be able to move and build a more connection, skills, innovation-driven ecosystem, and I'll be honored to be part of this conversation onwards. And thank you so much, and looking forward to your questions and comments that you might have. And that will be all from my end. Thank you.
Thank you so much, Madam Winnie. I'm sorry about that. The floor is open to anyone who has questions. We told you will take you from the classroom to how the innovation is work and then how to manufacture. So Madam Winnie has talked about how innovation and how you're going to bring it to life and what are the things she thinks it's there in the environment. So for us, can we have questions for her to ask her how we build our prototypes, how are we improving the way we are thinking towards innovation? So the floor is open to anyone who has questions.
On my end, there's a question by Mohangi. He's asking, there's this challenge whereby we do projects when we are at campus and they stop at prototype stage. Yet these projects will be very fundamental in improving healthcare, but due to many challenges, we fail to continue them. What would you advise that would help implement such projects?
I would actually say move away from the academic, build the innovation from that. It depends with the project that you started from academia, and you need to understand their IP, their IP policy around that. So be aware about that. You might start as a project from campus, and once you've gone out of campus and you like to proceed from there, get some clarity on how does that look like from that aspect of you moving forward as an innovator, and also and also seeing how that will be able to structure itself as a business, and away from the campus scenario. So one thing for sure, it's very much encouraged to move your project from just a campus to and continue with it, but you need to understand the IP policy that the campus has. We always advise innovations that or projects coming from campus be on its own independent outside the campus, because a lot of scenarios happens that the institute comes and claim part of the ownership to the device, even if you've successfully been able to move it and you've been able to move forward with your solution. So that's one thing you should be key about. And also, if you would like to kind of move forward from that, and move it to a solution growing after the campus, those are the key things. So the IP policy from the campus, and what are the restrictions, measurements that the university or the institution will have for you moving forward with the project. But ideally, it looks good when it's at the project side, but after the campus, maybe you should be able to kind of have another project that is not linked to the campus and move with that. That makes it even safer in prioritizing, not the institution coming to your way and owning a lot of ownership to your project, even though you're the one who kind of build the solution from the ground go. The other question I see is that, yes, the biomedical engineering is broader. And referring to my previous speaker, you need to do a better research and understand where biomedical engineering comes in. From the innovation space, as I mentioned, there's innovation from neonatal to diagnostics to IVD to NCDs and non-NCDs to tropical diseases, and to biomedical engineering doesn't have to have a solution in the diseases side. It could be in the system side. It could be in the manufacturing side, and that's why I said it's broad. It depends on what perspective you are coming in. and it could be on the adding on the biosimilars in the medicinal side. Biomedical engineering comes that way. In the AI, blockchain and machine learning, biomedical engineering come that way. So the innovation space in the biomedical engineering is very broad, and maybe that's something you will need to kind of do a bit of research and understand which perspective are you going to lighten your professional career and grow with that. It could be as well in the lab structures as well, which lab structures is also wide in that perspective. So which side are you leaning towards, and see fit which one will be your passionate area to lean towards, and then now you can onboard and do a better research, or even grow your studies further to kind of enlighten more towards the direction of the profession you like to merge into. Any other question?
I don't know if you've tackled this, but from Samuel Kirago is asking, people normally say when coming up with an idea, you should talk to people who are actually facing the problem. But most of the time it becomes hard narrowing down from what you have gotten. As someone who has been in this space, what does that look like for you, and how do you finally settle on one solution over the other?
Yes.
Is it
So you might be tackling a problem that is addressing different variety of how a solution could be embedded. So one thing for sure, you will need to do mind mapping. Yeah. Even if the solution addresses different types of users, you will need to narrow it down to that one user, and you'll need to make that decision. Yeah. So that you're able to create a solution that will fit for that particular users that you intended to have the solution towards them. So do a lot of user engagement, user adoption, understanding. You could actually onboard human-centered design, user-centered design, and mind mapping. And also you can one other tool you can embed or you can include is where to and how to access, that identifies the journey of where are you gonna develop and how you're gonna develop after understanding your human-centered design and your user adoption adaptability fit with the mind mapping concept. And one thing we always key are, once you've already understood the problem, you need to understand the solution fit. So the problem solution fit is very key, and the innovation fit in it is very key. And now winding it up to the product market fit. The product market fit comes in when you already have a market to actually address this problem to. So you don't want to be developing a solution for a very limiting market. You need to understand how will you be in a position to scale this product and not limiting it into a small population, but also being in variance that this is gonna be a business. You need to look at the business perspective. How am I gonna meet many market understanding so that my solutions are able to be bought, are able to be uptaken by the market very easily, very consistently, and not just staying at the shell and waiting for just that one particular type of a user to kind of come and buy it. So if you're looking at the idea stage, on board tools like mind mapping, on board tools like user-centric adoption mapping, on board tools like human-centered design, which is very key from your beginning, on board mapping, mapping on the where to and how to access tools, and also the whole understanding of make sure that the problem solution fit is accurate. That will also be in a position to help you understand what is your product market fit when it's going to market. We always insist doing a lot of market analysis, market surveillance, market understanding, so that you're not just asking the users, but the user adaptability angle, but you're also addressing the market understanding of where am I going to sell this to? How am I going to sell this to? How much? Looking at those things that I mentioned, the cost, where, how is it going to reach the people? Am I really putting the product to fit the market very well? Is this product going to be pleasant for the users to buy it? All those things is what you need to kind of time in when you are looking at the early stage of your understanding. Once you've drawn that into a good scope of where you think your innovation is gonna line into, then you bring the regulatory aspect as well at that early stage, because the regulatory aspect will help you understand how to design, what kind of restrictions am I limiting myself to, because they will guide you in terms of how to think through your design implementation, whether it's both system implementation, mechanical implementation, software implementation, electrical implementation. Understand what are the technical metrics that you will need to build in. And one thing that I always insist, even with innovators that have already had these solutions made out, is try and map your requirements for your solution from the user side, from the functional side, from the performance side, from the non-functional side, the safety, the maintenance, the manufacturing, all those, so that you're able to map out where does the design come in, where does the technical SI units required in my design come in into your perspective of also building your solution from the idea. So mapping all that in the initial idea stage will help you understand the kind of requirements that I will require to build into the solution. And I said the innovation side is just 0.1%. You have the 99% of the rest to do. So once you have an innovator and you've done some clinical trial or you've done some piloting, that's part of the 0.1%. Yeah. So there's so much more. And that's the previous speaker was doing about, don't just lean on one user, talking about the research, you get frustrated going back to the same users. Move your dynamics in the users, move from region to region, move from different places to different places, because the mindset of the user is very key. You need to understand how they think, because you can't go back to the same people over and over again. You need to iterate as much as possible. Also guide them to help them understand what you're really thinking about your solution, so that they understand whether this is something they will be willing to work with or not. So you don't just engage one way. It has to be both ways. And also keeping in mind the user adaptability concept, it has to be in phases. So you can start in phases. So you can do in this phase whereby you're just trying to understand the problem. Maybe that understanding of the problem, you can actually widen it up further and try to be more creative, so that you're able to actually understand and adopt the solution fit for that particular problem. So that's always the case. The problem are different, are many, you don't know what to draw down to, or the solutions are many for that particular problem that you don't know what to. That's the work of the initial stage that you need to do. That's the work, and that's the research you need to do. Yes. So there's the scientific research as well that you need to consider, that will help you understand how you will move from the idea to now having a prototype.
Thank you, Madam Winnie. I don't know if there is any other question.
I see there's a question here.
Yeah.
So as an engineer who approves medical device innovation proposals, what features in the innovation signals that a project has a great potential? What I've mentioned, problem solution fit and product market fit. Those are the two priorities that I look up for to see that there's a great potential, because those two aspects will answer whether you are innovative. Yeah, are you innovative? Are you addressing the right market? Are you addressing the right solution for the right problem? You might be addressing a solution but not for the right problem, or you might be addressing a problem but does not have the right solution, you know? So those are the things, the key things that I look up for. Problem solution fit and product market fit. Then to the next question, how do Wilgrow Africa support new need? How do Wilgrow support new innovators in Africa? If I need one, are there any requirement I needed to have? So Wilgrow Africa will come and support innovators when they are at TRL 3 at the lowest. But in some instances, we look for at TRL 4. Technology readiness levels is what I mean by TRL. You can look it up in terms of the medical device or in the technology readiness level. So technology readiness level 3 is, or maybe 4, we are looking at, you already have an MVP, the engineering concept has been established. So your innovation concept has been established that my mechanical is fit, my electrical works very well, my software that has been embedded actually works, you know, something that you've already done some more understanding of, that the concept that I had from ideas and I've put it in my MVP is actually working. So what I mean is to have already a functional device. And before that, if you need to kind of ideate a solution to a point that it comes to TRL4, you could work with design studios. Like KU right now are having a program for this particular thing, moving you from TRL1 to TRL4, whereby they help you map out your idea to a point that you have a prototype. And they have classes, I think they'll be beginning this January. So if you really want to be part of the innovation in the medical device site, you can join the program at KU, and you'll get more support on how to move yourself to have a functional prototype in it. So you can have that in it. And then there's the East African Biodesign Fellows that do pull out a call for fellows who would like to be in the field of healthcare and like to have a solution by the end of the fellowship program that runs for 1 year. So be on the look for that call, and you can apply, and you can kind of help you. They can actually they go ahead and help you embed yourself in that problem. They help you embed yourself in creating that solution. What are the things to consider broadly from when you're TRL1, which is the idea stage, to be in a position to get you to TRL2. Yes, that those two programs are really, really helpful to get you at a stage that you have a good understanding, you've drawn down to the problem solution fit.
Thank you, Madam Winnie, for that. People, if you have any other questions, you can either DM her on her LinkedIn, or and also share it with us through the group chats, and then we'll be able to either find answers to it or something so that we can move to our next speaker. Thank you for making time, Madam Winnie, for speaking to us about innovation and helping us to understand how to make our products viable for the market and how to develop it for the market. So thank you so much. So for our next speaker, we'll have Mr. Ronek Laura. He's a director in sales, marketing, research and development at Revital Healthcare and Revital Pharma Limited. He's the founding member of End Malaria Council. It's a government fund in Kenya. He's also the advisor to the Dean, City of Seattle. So I know he'll tell us more about whatever he does. So he'll talk more about manufacturing. He'll talk more. We have taken you through a journey from a classroom to how to innovate, and then maybe he'll touch something on manufacturing and tell us what he does and how we can bring our products viable for the market. So welcome, Mr. Ronek.
Hello, everyone. Pleasure being here. Thank you very much for the opportunity to speak to like minds, to the students, innovators of the future. It's a pleasure being here, of course. So I believe what I'll do is I can share my screen because I have a presentation that I have prepared. Apologies, just like the way Vinny has mentioned, I also as well use Zoom and Teams. It's the first time for me to use Zoom meetings.
Are you able to share it, Mr. Ronek, on your end?
Yes. Yes. I hope everyone can see my screen.
Yes, it's visible.
So I'll start off from the very beginning. Just to start off, my name is Ronnie Bora. I'm one of the directors in a company called Reimagining Biomedical Limited. We're manufacturers based out of Kilifi County in Kenya, where we boast to be the largest manufacturer on the African continent. Thank you. So I want to take you through the history of Vital because it is a 17 to 18-year-old company now. This is our 18th year. So 2008 is when the factory was inaugurated. It was inaugurated by the former late president of Kenya, President Mwai Kibaki. And the main reason why is because we wanted to set it in stone that Kenya finally has, and not only Kenya, but Africa finally has a manufacturing facility producing syringes. And that's the reason why we made it such a grand opening. 2009, we received our first WHO PQS approval. So this is the World Health Organization certification to manufacture reuse prevention syringes and auto-disabled syringes. These are game-changer syringes in the market today, helping us to help prevent communicable diseases from spreading, so like HIV, hepatitis, so on and so forth. So these are auto-disabled. They basically dismantle and break upon the use of this particular syringe. So we were the first manufacturer in Africa to receive the WHO PQS approvals, and out of 7 manufacturers in the world back in 2009. Mind you, we started very small. So we started with only 6 molding machines and only about 60 people working at Vital. Over back to the timeline. 2012, we saw that syringes is not the only thing we want to focus on. We want to start manufacturing other innovative products. So we looked at a hospital environment and we looked at what is required the minute the patient checks in. Yes, a syringe and a needle is required, but what else? So we started manufacturing blood collection tubes or vacutainer tubes, being the first manufacturer in the African continent to produce these products. We started manufacturing feeding tubes, IV sets, umbilical cord clamps, IV cannulas, and several other products. In 2013, we received the first investments from the Gates Foundation. This was to expand the production output, increase the number of countries that we are accessing to, and we saw that this is still a growing stage for Vital. In 2017, we relocated ourselves to where we're currently present right now, which is in Kilifi County, because the previous place that we had was too small. In fact, when we bought this piece of land, 5 acres in 2017, we thought that it'll take us a good 10 to 15 years to utilize the entire space. But unfortunately, fortunately, within a span of 2 to 3 years, we're able to actually fully utilize the 5 acres. And I'll explain to you further where we have utilized the fully 5 acres of the facility. 2020 March is when COVID came to Kenya for the first time. It was already around the world. It was echoing around the world. This is the first time my generation, and I believe many of you as well, has ever heard something called social distancing, where you can't touch your own family, your own mom, your own dad, your own siblings, my wife, for instance. I was not able to touch, hug, any of those things because we were not able to do this during the time of COVID-19. We were not prepared as a country. We were not prepared as a continent. We were not prepared as a world for this particular infectious disease to spread amongst us. In fact, I had family members which passed away at the time of COVID-19, and I was not even able to attend the funeral. So it was a really unfortunate time for the world, but it was a time when Africa woke up. It was a time when Kenya woke up. It was a time when we saw that we were importing things that could be locally manufactured, things that we could have innovated ourselves and locally manufactured for our own population. Because if you remember at the time of COVID-19, countries like India, countries in Europe, North America, they stopped exporting vaccines because they wanted to vaccinate their own population. That's the selfish minds that those countries and those continents had. That means we were the vulnerable population. Africa was the last continent to receive the first shots. We had countries in Europe and North America, as well as India, taking the first, the second, and the booster shots. So as a small company, in 2020 March, we say, what is it that we are going to do to help not only our county, not only our country, not only our continent, but we are going to go global. So first and foremost, we became the first and only manufacturer at the time of COVID-19 to manufacture surgical face masks. These were face masks that many of us were buying for 4,000 shillings for a box of 50. We committed to not sell it for more than 1,500 shillings as a local manufacturer. So we started manufacturing 300,000 pieces per day. In a span of 90 days, we flew in machines on an emergency basis. We brought raw materials from air freight. We had collaborations with the government of Kenya, with UNICEF and other global partners to manufacture surgical face masks. 300,000 pieces per day. We started manufacturing PPE kits, surgical gowns, isolation gowns. We also started manufacturing syringes used during the time of COVID-19 vaccinations, the 0.5 ml vaccine syringes. In fact, His Excellency President Uhuru Kenyatta, in his final State of the Union address, mentioned 1 out of every 10 syringes used globally for COVID-19 vaccinations came from Kilifi County. 1 out of every 10. So you could see the impact that Revital in Kenya made globally at the time of COVID-19. We didn't stop there. We innovated. We innovated our own viral transport medium. See, these are the kits that we had to use when we wanted to travel. When I had to go to Europe to present my case to UNICEF, when I had to travel to countries outside of Kenya, I had to do a special test, one through the nose, one through the mouth. We innovated those tests because the tests which are coming from China, from India, and from Europe all required cold storage facilities. But how many counties have cold storage facilities where they're storing these specialized test kits? You know what we did? We have our little R&D team. We innovated our own formulation, which is room temperature between 2 to 30 degrees Celsius. That means you didn't require any cold storage facility. What we did was we innovated our own homegrown solution for our own people. That's what we want Africa as a continent to see. We have many young like minds, we have many innovators, but just not the avenue to grow and expand into. Back to my timeline. I mentioned the particular syringe we were manufacturing, the 0.5 ml syringe. We were manufacturing 3 million pieces before COVID. In a span of 6 months, which is 180 days, we expanded our capacity tenfold. So from 3 million to 13 million pieces per month. So I'm talking about over 300 million syringes of 0.5 ml were exported around the world. And I'll mention some of the countries that we hit, which was the biggest milestones that not only I have personally achieved, but even our own continent has achieved. In 2021, we had the biggest milestone at that time, which was to manufacture 1 billion medical devices in a product portfolio of 40 plus products. And at that time, I was exporting to about 28 countries around the world. In 2021 as well, towards the ending, and 2022, we received a special call from the Bill and Melinda Gates Foundation, which is now known as the Gates Foundation. And this was still the time of COVID-19. This was still the time that that one particular syringe I mentioned to you all about was used actually and is still being used when a baby is born. You're all vaccinated. If you lift your arm on your left hand side, you'll see a little mark on your arm, and that's through a vaccination that all of us has done using a very specialized syringe, the 0.5 ml syringe. So the Gates Foundation saw that there was going to be a very big shortage in the world with COVID-19 vaccinations increasing. The children or the births are not stopping anywhere. It's the births are still continuing. And the same syringe is used for vaccinating of children. The same syringes are used for vaccinating COVID. There is going to be a big shortage. So that's when Gates Foundation came through us with a grant for $4 million. Now, they wanted a special syringe. They didn't want the syringe that we were already manufacturing. They wanted a syringe which is known as an early activation syringe, which means the minute you pull the barrel from the plunger, the syringe mechanism of activation has activated, which means the minute you use it once, it cannot be used again. That's the syringe the Gates Foundation wanted us to innovate. So we have manufacturers in the world at the time of COVID-19 in 2022 in China and Europe. They were manufacturing those particular syringes. We didn't have such innovation in Africa. So we went naturally to them because, like I mentioned, the world unit needed to unite. We had to bring stakeholders in, we had to bring governments in, we had to bring manufacturers in, and we had to think in a unity perspective. So guess what we did? We went to China. We went to one of the manufacturers, which was manufacturing at the time of COVID-19, these particular syringes, and was exporting around the world. We requested and we begged to them if they can use their innovation and technology to manufacture those particular syringes and help the world with COVID-19. You know what the Chinese say? Sorry, we cannot help you. So you know what left us with we were quite disappointed, honestly speaking, but something happened and a shift of mind changed and said, why can't we innovate our own particular syringe early activation? So we did that. We innovated our own early activation syringe. We manufactured brand new machines that the world has never seen, because remember, there's only 3 manufacturers in the world, one in China, one in India, one in Europe, and we were the 4th one right now as we speak. So the brand new machines were innovated within 9 months with the funding from Gates Foundation. We innovated, we created the machines, and we started manufacturing. 6 months after that, through the support from global donor funding partners like PATH and FIND, we're able to get our WHPQS and then sell to UNICEF the entire 300 billion pieces of syringes, which are going to countries that Africa has never mentioned to you, which I'm going to mention to you in my next slide. Jumping to 2023, that's when US aid was not defunct. It was still well and alive and working on several programs around the world. 2023 is when US aid came to Kenya and to Revital Healthcare specifically and said, we have a grant opportunity, a co-funding grant opportunity. So together we invested about $4.5 million, which in Kenyan shillings is about 600 to 700 million shillings. We built Africa's largest rapid diagnostic test kits facility, the first end-to-end manufacturing facility, the first lateral flow facility where we're producing 20 million test kits per month. So that's over 200 million test kits per year, focusing primarily on communicable diseases. So that's HIV, malaria, hepatitis. That's what we're focusing on right now. But we're coming up with other products like pregnancy test kits, pox test kits, syphilis, dengue, drugs of abuse, livestock testing. So we want to innovate a lot more products into that current facility that we have for RDTs. And then we received a small investment from Ohara Pharmaceuticals. This is the second round of investments from this Japanese company. So we have 3 Japanese partners now on board: Ohara Pharmaceuticals, AIC Pharmaceuticals, and the third company being MOL Logistics, which I'll mention to you more about how those 3 companies have become strategic partners. Moving on to my next slide. So I want to draw your attention to the left-hand side of the screen. This is a family-run operations, as you can see on the right-hand side of the screen. But to draw your attention to the left, I mentioned when we started in the year 2008, we only had 60 people. 17 years down the road, we have 650 plus people working in Revital Healthcare 24 hours a day, 7 days a week, 365 days a year. You heard that right. during Christmas, during New Year's. We have dedicated employees who are still producing syringes and other innovative products which are going to countries around the world. Our entire work staff is 99% Kenyans, including myself. I'm a third generation Kenyan myself, and 80% of the entire workforce is female staff. On the bottom left-hand side of the screen, you see about 20 to 25 young women. These are all women who are hearing and speech impaired. My great-grandmother was hearing and speech impaired, and the family said, as part of our CSR projects that we do, we want to give the less fortunate a chance to do something that is being done by every other person within the factory. So these wonderful women actually have a very, very special job. You know, the Gates Foundation grant I mentioned to you about the particular syringes that we're manufacturing. So these 20, 25 young women you see over here are actually the women who are assembling these syringes and going to countries around the world, which I mentioned Africa has never ever thought about, right? So let's look at Africa on the left-hand side of the map. We've conquered about 20 to 24 countries within the African continent. But when you look at the broader spectrum of the world map, we have gone to continents in Asia, in Europe, in South America. So that means we're the first manufacturer on the African continent to rewrite the history books of Africa by sending syringes to India. Have you heard that before? Sending syringes to India. We know India, Europe, North America are always the continents or countries sending their medical devices, vaccines, diagnostics, test kits into Africa. But at the time of COVID-19, we reversed roles by sending syringes to outside of Africa. We sent over 20 million syringes to India to help them in their COVID-19 vaccinations. We're currently the exclusive manufacturers and distributors to the Pakistan government. We exported syringes to Nepal, Sri Lanka, Uzbekistan, Yemen, Pakistan, so on and so forth, including 4 countries in Europe. We sent syringes to Canada. We've sent products to Brazil. So you can see by just innovation and pure determination, we're able to export to 45 countries around the world. And how do you think we all achieve this? The main reason why is because this company has invested heavily in their certifications and regulations and registrations, if you may say so. So we've got CE certification, which enables me to export to any country in Europe. I've got US FDA, currently 1 product, but we're applying to 17 more products because we're interested in even sending products to the US. We don't only want to be known as a continent as a net importer. We want to be known as a continent where we are the net exporter. And not only a net exporter of products like tea, mangoes, avocados, coffee, things like that. We need to start thinking outside of the agricultural box. We need to start thinking innovative, and healthcare is the future in Africa. So that's the reason why we are registering 17 products in the US FDA, because my next goal in 2026 is to be the first manufacturer in the African continent to send syringes to the US. But ISO 13485, 14001, 9001, I've got 58 products registered in WHO GMP. I've got about 10 products now registered with WHO PQS. And then we've got a very unique certification known as the MD-SAP. This is the Medical Device Single Audit Program, which is covering 5 countries in the world. US FDA, which is US. We've got Canada, Health Canada. We've got Australia, which is TGA, Japan. We've got Brazil. Now, to sum all of this up, we're now a proud manufacturer producing more than 2 billion medical devices annually. We're exporting to about 45 plus countries around the world, and we are the largest manufacturer on the African continent, producing all these products that you see on your screen right now. So that's about 58 products, focusing not only on syringes, which is my core business, but we're also covering all these other products related to neonatal, laboratory, tubing, PPEs, diagnostics, and we're not stopping there. We're going to keep expanding. Now, just to drum up some support, this is the particular syringe I was telling you about, the 0.5 ml, our own innovation, our own technology, which was actually is a patented syringe, US FDA certified, WHO PQS approved, exported to now about 38 countries around the world. It was also featured in the New York Times. I encourage you all to actually read this article. Not only in New York Times, by the way, it was also published in the Bill and Melinda Gates Foundation website as well. So I encourage you to read this article and just to understand how innovation has helped Africa change in terms of manufacturing. Just another screenshot about this particular syringe. We all know malaria vaccines have come out, and this particular syringe is also being the one going to be used for malaria vaccination. So my company is already thinking about expanding its production output from 25 million pieces per month to now 35 million pieces per month. The rapid diagnostic test kits facility I mentioned to you about was actually inaugurated last year by the then U.S. Ambassador Meg Whitman, my governor you see over there, Governor Gideon Barra from Kalifi County. The Minister of Health was there, as well as several dignitaries. I mentioned to you about how we're producing 20 million test kits per month, how we started off as a small manufacturing facility producing only 2 million test kits per month. These are some of the partnerships that we have been able to conquer in just the past few years after establishing this rapid diagnostic test kits. Just about a month and a half ago, we announced Merrill Diagnostics partnership where we're going to be manufacturing WHO PCARS approved malaria diagnostic test kits, the first manufacturer on the African continent. This company based in India called Merrill is the largest manufacturer of rapid diagnostic test kits. Biosensor, WHO, PEPFAR, Global Fund, FINE, United, all come in strategic partnerships with us in terms of scalability, innovation, as well as just pure support in becoming a very unique industry on the continent. Along the times of COVID-19, we actually came across a company called Bio Global Health, which is based out of the US. This was also at the time Bill Grove came to us with Rob, a very, very good friend of mine, an amazing company, I must say, that we all should research on, Bill Grove Health. So this is a professor on the left-hand side. He's the innovator of this product called BioBubble CPAP device. This is the world's first non-electric, non-battery powered CPAP device. So for those of you who don't know what a CPAP is for, it's actually meant for premature babies to provide safe, regulated oxygen. So when a baby is prematurely born, they require the right amount of oxygen. Too much, too little can cause brain damage, loss of eyesight, and the worst case scenario, death. Now, more than 1 million babies in Africa are born prematurely. I was born prematurely as well back in 1989. But I was lucky enough to be born in a hospital where the doctors knew how to treat me in the right possible way. But we have rural areas where we go to places like Busia, Mandera, where they don't have a constant flow of electricity. They don't have backup generators. And they have all these expensive CPAPs, which are donated by USA, by the UK FCDO, by UNICEF. And they all require electricity. They all require some kind of battery operations. But what happens when the electricity stops? There's no ifs, there's no buts, guys. The baby dies. That's it. The baby dies. So this professor saw this problem and said, I need to come up with an innovation that doesn't use electricity, that doesn't use battery, and it's cost effective, it's easy, simple to use. So this is a completely manual powered bubble CPAP device, the world's first, as I mentioned to you. It's already saved 160,000 babies in over 25 countries around the world. It's $400 only, 100% reusable. And I mentioned to you earlier on, it's gone to 23 countries plus, but I mentioned to you right now, it's actually 32 countries around the world. So not only Africa, but it's even been in countries like the US, Brazil, Ukraine, Poland, Nigeria, etc., etc. This product is also supported greatly by all these organizations that you see over here. In fact, USAID, before it went defunct, provided Revital with a grant of $1 million. This was to provide all 47 counties in Kenya with this particular device to help save babies. If you see cases, recent most cases where mortality has increased because of this particular device, where babies are not dying for lack of oxygen or they're not having the right amount of oxygen. We did a flag off at the time of 2023 with the First Lady of Kisumu County. We donated 220 units to Ukraine. This is a live example of what these babies are currently using. Till to date, these babies are using this particular device. And it saved more than 1,000 babies just in Ukraine itself. We know what's happening between Russia and Ukraine. There is no hospitals. There's no children's hospitals. The picture that you see on the bottom right, That's actually a hospital with no roof, but it's a canvas which we use to cover trucks with, a canvas that's used to cover the baby from bomb shrapnel. And what's being saved using the baby is a bubble speaker and an oxygen cylinder tank. That's it. Do you know, by the way, that particular baby you're seeing on the bottom left is actually 3 years old today and living and breathing happily. Because of what we did with Ukraine, United Nations actually acknowledged us. If you read this article is there in the United Nations website. I encourage you all to read this article just to understand what impact this particular device is doing. Now, as I mentioned, we're not stopping. We're going to continue growing. And our next project is entering into the US. How we're going to enter is through this one particular syringe. That's where our footprint is going to enter into the US. You can research more about this particular syringe, but it's a nutritional feed syringe where patients who cannot digest food or who cannot eat food are actually using these particular syringes to provide them with their feeds on time-to-time basis. The next product portfolio that we are currently expanding on is laboratory items. Can you imagine none of these products that you see on the screen are actually manufactured in Africa? Everything you see on the scene, petri dishes, pipette tips, urine and stool containers are imported. So that's the main reason why we saw that, you know what, let's get into the line of manufacturing of laboratory items as well. So we're the first manufacturer in the continent of Africa producing petri dishes, pipette tips, cryovials, and so on and so forth. Now, where does this lead to? What is Revital's future growth plan? The future growth plan comes to where we study what happened at the time of COVID-19. I mentioned to you all, we were lacking some basic commodities because freight containers from India to Kenya was $15,000. Something that cost $900 right now costed us $15,000. It took us 120 days to bring products from India to Kenya. It took us 150 days to bring products from China to Kenya. Not because there was a shortage, but because the freight containers were so little and there's so many goods required on the African continent that there's a huge backlog. And that again shows a very glaring fact that Africa as a continent was not ready and prepared for that particular pandemic. We have organizations like UNICEF, which we supply to currently, and we are even supplying at the time of COVID-19. They're sending syringes to Copenhagen in Denmark, only for them to send syringes to Tanzania, for them to send syringes to Uganda. Funny, where is Tanzania and Uganda? To Kenya. It's right next door neighbors. That's the reason why our next project was born, which is providing healthcare securities in Africa. So we did our market study. We saw that there are 6 major organizations in the world, one of them being UNICEF, which is doing a business of about $5 billion annually. So what UNICEF does is they buy products from China, from Europe, from Revital in Kenya, take it into their facility in Copenhagen, build it into kits, and then now send these kits into Africa. So we have classroom kits, we have hygiene kits, we have recreational kits, we have menstrual kits, we have so many different types of kits. But all of these kits are actually assembled and manufactured in Europe, in Copenhagen, by UNICEF. At the end of the day, where is all of these products coming into? As I mentioned to you, it's coming into Africa. So it just makes logistical and basic sense to do this in Africa. So we try this out. We tried this in the year 2024 when we won the first contract with UNICEF. It was about an $11 million contract. Just about a week and a half ago, I received some very good news that I've won another contract with UNICEF for 2026 and 2027, which is about $13.5 million. And that's also to provide syringes as well as safety boxes. Back to my slide. So we set this as an example and we say, you know what, let's start this. Let's start UNICEF as an example. So we've built our current facility, which is 2,200 square meters of space. It's a very small facility if you see in terms of pallet size compared to what we're building in the larger scale model. You can fill about 1,000 pallets. There's room on the bottom and right hand side of the screen. If you can see, there's a cold chain facility where you can store vaccines. There's an ice pack freezer room. There's a whole storage area where you can wrap the goods. And there's an entire kitting area. So now we can proudly say that Kenya and Revital in Africa can now finally package kits. So what I mean by kits, I'm talking about when you want to administer a vaccine, yes, you need a vaccine. Yes, you need a syringe. But do you know you actually need 15 other consumables? You need a safety box, you need gloves, you need a face mask, you need a PPE kit, you need alcohol swabs. You need all of these products just to carry out one vaccination drive. So that means when one of these products are missing, when a syringe is missing, when a glove is missing, you can't carry out the vaccination drive. And that's not possible now. And that will not be possible now because of this facility that we're building just across Mombasa in a special economic zone called Dongokundu. So we've been awarded by the government of Kenya a 20-acre piece of land where it's about 5 kilometers from the port of Mombasa, 15 kilometers from the international airport. We're going to be building a mega facility. This is about 5 warehouses that you see in front of you. Each warehouse is going to be specializing in a very special way. So the first warehouse being a health kit assembly, second warehouse being pharmaceutical repackaging, third warehouse, fourth and fifth being its own strategic visions that we have on board. Just some more visuals of what this warehouse is going to be. But the idea and the aim of having this facility in place is to buy products which are produced by Revital Healthcare, to buy products manufactured in Nairobi, which are pharmaceutical products, to buy gloves from Uganda because Uganda has the first gloves factory, to buy products from Tanzania, Ethiopia, Malawi, Mozambique, Congo, to bring all these products into this particular facility, create them into kits, and then even offer them for last mile distribution across the African continent and across the globe. This is in a very quick summary about Revital Healthcare and what our strategic vision is within the African continent. I'm happy to take any questions that the audience has. Thank you very much for listening to me, and thank you for giving me, especially Revital Healthcare, a chance to speak to our wonderful young innovators, our young minds across this. Thank you very much.
Thank you, Mr. Ronek, for that. As you see already, there is job creation from his talk, as he has told us. So the floor is open to any question. You can type on the chat or you can speak up.
On with the question, just raise your hand. I will give you the mic to speak.
Mr. Ronek, you being in the industry for manufacturing, how do you, what advice can you give people who are looking towards a future of starting their own company, starting their own business in terms of manufacturing products? What advice can you give people in that section?
Very great question. I want to give you not Revital, I want to give India as an example. What India has done is they've created something called cottage industries. So what I mean by cottage industries is when you look at a product like IV set, an IV set has many components to it, about 16 different components. What India has done is manufactures giants. They don't manufacture everything. Just like car companies, they don't manufacture everything. They buy from small companies, leave the headache onto them. What I want to encourage the young minds over here is think about a cottage industry. You don't have to start with 6 molding machines, 60 molding machines. You can start with 1 molding machine. Start producing products. Start supplying to organizations like me, where you can now be part of the value chain addition, and then slowly grow into that possibility of expanding your production output. Another very important thing I want to mention to you all about is I encourage you to go to hospitals, go to meet doctors and nurses. Ask them, where do you have challenges? What problems do you have when you're treating patients? When it comes to tools, whether it comes to equipment, what would you like for something like a problem-solving challenge. Get that information from doctors and nurses because that's the end customer that you have. From that, go backwards. Start thinking about what the doctor or the nurse say, where the challenges are, and that's where you start innovating your ideas and culminating a product that would be useful for that particular doctor or doctors across the county or doctors across the continent. You.
Thank you so much. Is there any other question?
There's a question from Samuel. He's asking, how do you manage? How did you manage to position yourself to get all the support? Because he believes it has been very instrumental for the growth of Revito Healthcare.
So to answer your question, Samuel, like I mentioned to you, it's not easy. In 2008, when we started this factory, we actually had Chinese manufacturers come to us, come and meet us, and actually tell us on our face, we're going to close you down. We're going to sell products below your cost of manufacturing to purposely close you down. But through determination, hard work, and the beautiful team that we have, 17 years down the road, we're proving the Chinese wrong because they don't exist now in this part of the world. They're struggling to come into this part of the world. So I believe you should have determination. You should have a plan in mind in terms of what you want to do. And then you have all the support systems available within our country. I mentioned to you one such organization is Bilgro. Bilgro has actually helped us nurture the idea of manufacturing rapid diagnostic test kits. It was through a good collaboration with BCG out in Nepal. Bilgro was part of it. That's how our vision for RDTs was born. So I would say to the young minds, keep half an hour away from TikTok or Instagram, Facebook, or whatever it is that you guys do, and research on organizations like Bilgro. And there's like-minded organizations like Bilgro as well, based in Kenya, who can help support you. For that question, I believe I can take the next question. Are you open to take in new innovative ideas from uprising biomedical engineers across the continent? Yes, we are. We are highly available to discuss innovative products. In fact, as we speak right now, we're speaking to about 6 different companies across the continent and the world who have their own innovations, who want us to manufacture for them. So that's what we're currently doing right now. In the next 1 month, 3 months, 6 months, 9 months, we will be launching these products with these 6 or 7 companies that are currently speaking to us. I will take this question from Dina as well. Are there opportunities for young engineers to contribute to early stage product ideation or research in Revital or mentorship programs? We have currently got several MOUs in place. One particular MOU is with Wani University just down the road where we take internships in my facility. So the good thing about a manufacturing facility is you have a wide spectrum of departments. You are a marketing major, you have a marketing department. You're an engineering major, you have an engineering department. Are you into storage and logistics? We have this. Are you into finance? We have that. Are you into R&D? We have that. So yes, we are open to having students come and learn and be a part of Revital and hopefully get a chance to grow themselves into the future ambitious leaders. I will take Paul's question next. Do you really showcase your work or market through social media as Revital company? I'm not sure what that question particularly means, but
I think he wants to know about your sales or marketing strategies when it comes to Revitol. Like, do you leverage on social media, or how do you go about it when you're marketing Revitol?
social media is a key. The social media is, we all know, is the future. I have my free time in between. I'm always on one of these social media programs because that's where I get to access my market. We have other opportunities where you, for example, pay to be in the newspaper, or you pay to be in the TV or the radio. or you pay into going for conferences and things like that. Those are all paid. We have beautiful thing called smartphones. We have beautiful thing called social media, and that's where you can access your free market from. So yes, I do particularly invest a good amount of my time, and not only me, but my very good team that I have helps me market Revital Health Grid through social media. But at the same time, we use other platforms, like I mentioned, radio, TV, newspaper, and the global news channels as well, such as CNN, New York Times, Nikkei, Gates Foundation, Washington Post, so on and so forth.
I don't know if there's anyone else with another question. If not, or if you have, you can contact Mr. Ronek through his LinkedIn. I know he'll be able to answer you, or you can put it in our chats and then we'll be able to answer you. So thank you so much, Mr. Ronek, for making time and speaking to us and showing us your journey as you've grown the Revital company from production to selling to collaboration. I think one thing that resonates with me through the whole speakers, with every speaker who has come before you, it has been talk to the doctors, talk to the nurses, do your research, do your market research. And it's things that we students maybe we may not know, but it's something that you've told us, you've given us an insight to it. So I'm really grateful for that. We'll have our closing remarks from Mr. Amos Gideon. So Mr. Amos, you're welcome.
Hello, thank you. I'll take this opportunity to give the vote of thanks. My name is Amos Molinge Gideon. I'm a field service engineer and I'm an ISO 13485 pioneering ISO 13485 certification in Kenya. So on behalf of all participants and the wider biomedical engineering community, I'd like to express my sincere gratitude for the impactful and deeply enriching session on reimagining biomedical engineering in Africa, from repair to innovation, shaping Africa health tech future. So this event has been truly inspired and reminded us of the vital role of biomedical engineers, which play in strengthening healthcare systems across not only in Kenya, but also in the African continent. First, our heartfelt appreciation to Caroline Wanjiku, the co-founder, and Dennis Karani, the founder of Africa Lab, which I've seen him building, and I know it has been a long journey for him. For your excellent and moderation done by Caroline Wanjiku. So your guidance throughout the session kept the discussions insightful, engaging, and well aligned with the theme of the innovation in the Africa healthcare. So to our exceptional speakers, Winnie Kibiru, the Meditech lead at Vigil Africa. Thank you for your powerful insights on Meditech innovation, ecosystem development, and support structures needed to nurture African biomedical entrepreneurs. Your contribution shed light on the importance of partnerships and capacity building. So to our next speaker, who was Mr. Ronek Vora, Director of Revito Healthcare EPZ Limited. So your presentation was incredibly inspiring, hearing from a leader driving large-scale medical device manufacturing, not only here in Kenya, but also in Africa. So I was happy to hear that, as a person who is in the regulatory field, I was happy to hear that you have a CE and FDA certification, which is a lead for market in the US and the Europe. So thank you for emphasizing on local solution, quality standards, and the true future of Africa medical device technologies. To our first speaker, Patricia Nabifo, biomedical engineer at Uganda. Your perspective as a biomedical professional working at the heart of healthcare delivery was powerful. Thank you for highlighting real challenges, opportunities, the need for continuous skill development and innovation among young biomedical engineers, and your journey from classroom to the field was impactful. So special words of gratitude goes to Revito Healthcare and Viltro Africa. Your role in nurturing medtech innovators, offering mentorship, funding, and strategic support to build sustainable healthcare innovation in the continent. So to Revito Healthcare, for your continued commitment in advancing healthcare solutions across Africa and championing local manufacturing is essential in the development of the healthcare system in Kenya. So to all the participants, biomedical professionals, students, innovators, stakeholders, and everyone who joined from Africa, from Kenya, Uganda, Ethiopia, we thank you for your time, your engagement, and your passion for transforming African health, transforming healthcare in Africa. This session reminds us that the future of biomedical engineering in Africa is bright, collaborative, and full of promise. Let us continue to innovate, equip, transform, and our healthcare system together. Thank you, and let's continue building a stronger healthcare in Africa. Thank you.
Thank you so much, Mr. Gideon, for the closing remarks. I'll give it over to Karani to close for us the meeting.
Thank you. Thank you, Carol, our moderator, and also who happens to be the co-founder. I would love to give much appreciations to everyone who has taken their time to be part of this first session for Africa Lab. To all our speakers, mentors, I'm humbly, I am so much humbled, and I really thank you for being part of us. Today, we've done more than attending a webinar. We've opened a conversation that has been missing for years, a conversation about what biomedical engineers can be, not just what we've been expected to do in the past years. This session, as we started earlier, was designed to do one thing: shift our mindset from a technician to innovator, to understand there is something we can do beyond whatever we've been doing. My mantra has always been one: we can go beyond imagination. We can be able to build breakthroughs as we empower generations. And that is what Patricia is doing at Uganda, Vilgro Africa, they are doing here at Kenya, and also Revitol are doing. So Africa Lab will be a community to support each other, a space where industry meets students, a platform where ideas meet real world problems, a movement that puts African biomedical engineers at the center of Africa MedTech future. And today proves that we've done it, and we are not alone. So what do you expect from Africa Lab in the next sessions or in the next things that will be happening? We shall have more conversation that turn into clarity, more mentors who turn into guides in our journey, and soon practical experience to turn our knowledge into impact. We will keep sharing upcoming mentorship sessions, innovation talks, collaborative projects, and opportunities how to grow your skills and visibility. As young engineers, you have the responsibility after today. Start asking yourself, what problem in healthcare are you willing to solve? The question will define your career more than any guide or certificate ever will. And Africa Lab, our promise is very simple. We will work with you, guide you, equip you, get to equip you with the right people to talk to, the right people to seek mentorship from, so that we bring the ideas or the solutions to the problem that exists. Lastly, also I would love to say that as we close, remember, Africa healthcare future is not going to be imported. It will be engineered by people like you, people like us, who are ready to build breakthroughs, empower generations as we reimagine biomedical engineering in Africa together. Thank you. So we hope that you stay connected, stay inspired, and stay bold. Would love
Thank you
to
so
close. Okay, continue,
Thank you
Kara.
so much, Karani, for the insightful words. We'll close with a word of prayer. Let me just pray, and then we can break. You can all leave at your own pressure. Mighty Father, mighty God, I say thank you for each and everything you've done to us. Thank you for giving us very insightful on how to reimagine biomedical engineers, as we are the futures of biomedical engineering in Kenya. May you continue guiding us to be innovators, to be researchers, and to learn the market in order to produce for it. Thank you for giving us the speakers as we continue to build this conversation, continue guiding us and protecting us. I pray this short prayer through Christ our Lord. Amen.